Colleagues, family, and friends, we welcome you to our 2023 Fellowship Forum.
Welcome, everyone. My name is Janie Boren, and I'm the Executive Director of the Randall Lewis Health and Policy Fellowship. Welcome to the 2022-23 Fellowship Forum. We're so pleased to be celebrating the completion of our 12th cohort. There's many people to thank, and this year, of course, I'd like to start with thanking Randall Lewis. His vision and continued support of the fellowship has opened so many opportunities for students to gain valuable experience in the public health, built environment, and healthcare sector. The fellowship continues to grow and gain amazing partners because of his guidance. Our board is also a tremendous support for the fellows, and this year, several of our board members participated in our learning sessions, providing real-world experience with amazing discussions. And many of our students are continuing to follow with our board members as mentors and for continued networking. Our sites also are what set us apart from other fellowships. The strong leaders that provide preceptorship and mentoring give our fellows an opportunity to spend 8 months learning from the best. Could not do this without you, so thank you. I'd also like to thank the support of our universities. We continue to draw our fellows from universities all over Southern California. We'll begin the Fellowship Forum by hearing from some of our board members. And to start, please welcome Dora Barilla, our Partners for Better Health founder and president.
Congratulations to the 2023 cohort of the Randall Lewis Health and Policy Fellows. We hope you all had a memorable experience and that you're leaving the fellowship with a stronger network, more wisdom, and a building block for your resume. We also want to thank you for your interest and your passion in learning about improving health and well-being in new and innovative ways. Regardless of whether you're receiving your degree in public health, health administration, public policy, or urban planning, the future challenges that our world face are going to need leaders that understand that you need to work across sectors, that you need to have common language, and that you need to work together. And that's you. Thank you for taking the time. We wish you all the best. We have one request, is that you stay in contact with us and that you share your successes. Congratulations and be well.
12 years ago, the fellowship began, and Randall Lewis has been the leader behind the scenes, supporting not only financially, but as a guide and mentor. Mr. Lewis inspires by his example. He is a reminder that each one of us can make a difference. Thank you, Randall Lewis, for this fellowship that helps guide future leaders and makes our communities better.
Greetings, Randall Lewis Health and Policy Fellows. I am Colleen Flynn with Build Healthy Places Network, and more importantly, I'm a board member for Partners for Better Health. I'm here to congratulate you on finishing up this fellowship and so excited to see where the journey takes you. We've been able to host various different fellows throughout the years, and they've all gone on to do amazing things that usually tend to involve some type of cross-sector work to think about improving health outcomes. So take good care and enjoy the celebration.
Congratulations, Health Policy Fellows. What a wonderful achievement. As you embark on the next phase of your career, I have a few thoughts I'd like to impart. May you continue to be passionate about health policy and the impact it has on people's lives. I hope you use your knowledge and skills to make a positive difference in the communities that you serve. Whether you work in government, nonprofits, or the private sector, always strive to make a meaningful impact on the health of individuals and the communities that you serve. I hope you stay curious and continue to learn, embracing a growth mindset. Health policy is constantly evolving, and there's always more to discover, so keep up with the trends and never stop to ask questions. I hope you find synergies and work collaboratively with others to achieve your goals. Health policy is a complex and interdisciplinary field, and you'll need to work with people from a variety of backgrounds and perspectives. So be open-minded and respectful and seek out opportunities to learn from others. My final thoughts are that you take care of yourselves and each other. Working in health policy can be challenging, and it's important to prioritize your own physical and mental health. Lean on your colleagues and support networks when you need them, and don't be afraid to ask questions. Once again, congratulations on your graduation, and I wish you all the best in your future endeavors as a health policy professional.
Now, a special message from our alumni.
Hi everyone, my name is Colleen Corrigan. I had the pleasure of working as a Randall Lewis Health and Policy Fellow last year for two nonprofits. One was Community Initiatives Network and the other was IP3, the Institute of People, Place, and Possibility. I feel really lucky to have two locations for my work, and it allowed me to interface with both health policy as well as data capacity. And I was really enmeshed in a lot of discussion and development of resources and partnership meetings, and I provided technical assistance to some of our partner organizations, similar to what a nonprofit consultant might do. And I was given the creative freedom to also be a contributing writer for a public goods platform. So I wrote blogs and briefs, and helped develop a lot of stories and resources for community health. I wrote 6 pieces on my experience in environmental health, and I got to cater it towards my interests and the needs of my placement organizations for their work. And my work as a Randall Lewis Fellow really prepared me well for my current role. I work as a Peter Harbich Fellow for an organization called Children Now. So Children Now is a state-based advocacy and research organization for children's health, education, and welfare issues. We're in the process of launching the California Alliance for Children's Environmental Health, which I'm really spearheading, and we're also hoping to share and really promote our advocacy work around lead in water, Medi-Cal asthma benefits. We do a lot of work around anything from education, making sure our schools are safe and that they represent our children, all the way to thinking about how to mitigate pesticide exposure for kids when they're in school. So I feel really lucky to be working on 2 bills that are being sponsored this session, and I never could have gotten here without the stepping stone that the Randall Lewis Health Policy Fellowship prepared me for. I would really recommend taking full advantage of the resources and network that you have at your disposal as a fellow, and making sure that you're connecting with people and asking them about their interests and their work, and seeing this as a challenge and opportunity for growth, not just a box to check. So, try and take on a new hat or a new lens. So if you love data, try getting your hands in development or in grant making, or if you love policy, try digging into research. And I think especially within public health, that's where you'll find your greatest strengths lie, is actually in things that you haven't had the chance to work on. And thinking more about the skills that have helped me the most, I'd say really critical thinking, and when it comes to policy, thinking about all sides of the issue and where opposition might come from. Even if we think it's grounded in social determinants and a public health lens, you never know what other lenses different sectors or opponents of a bill might be having. Also thinking about implementation of a bill, not just passing it. So a lot of our work at Children Now is administrative advocacy, which takes a new whole set of skills in making sure that policies are reaching people where they are and that they're actually implementable. So I know you're all in really good hands, and this period of life, I know for me, was really a bit scary, but make sure that you're connecting with your peers and everyone that this fellowship puts you in touch with, and just stay curious, because I have learned so much just by reading and attending webinars and trying to know all that you can about a topic or issue, but also staying humble about what there is to still know. So best of luck, and I know you will all go on to do wonderful things.
Hello everyone. I'm thrilled to be here today to welcome our newest fellowship cohort. On behalf of the entire team, I want to extend a warm and heartfelt welcome to you all. You are embarking on a journey that is going to be filled with learning, growth, and opportunities. This fellowship is designed to help you achieve your goals and aspirations, and everyone is committed to supporting you every step of the way. As you begin your fellowship, I encourage you to embrace the challenges and opportunities that will come your way. Be open to learning new things and stepping out of your comfort zone and making meaningful connections with your peers. I want to share with you my personal experience as the connections I built during my fellowship helped me find my first job after the master's. The connections you make are very valuable and will give you the social capital needed to succeed in current job market. Over the course of the fellowship, you will have the chance to work on exciting and amazing projects and receive guidance from amazing preceptors. This is a great opportunity to extend your knowledge and skills, and I'm confident that you will emerge from this experience better equipped to make a positive impact in the world. Once again, welcome to our fellowship community. We are thrilled to have you here, and we can't wait to see what you will all accomplish in the weeks and months ahead.
Hello, everyone. My name is Sheila Sanyo. I'm a Master of Public Health graduate at Cal State LA and part of the 2020-2021 Randall Lewis Health Policy Fellowship and Partners for Better Health cohort. Like many of you, I was very keen on the fellowship program because of what they offer master level students interested in health programs, policy, and related disciplines. My overall experience with the 8-month-long fellowship was positive. The fellowship provided me with some educational and professional opportunities, so I took advantage of the classes offered during the fellowship program. At that time, I was then already working full-time at a major HMO healthcare organization and was looking to gain more experience in project management in public health in a healthcare setting. I was assigned to the Adventist Health Simi Valley Hospital as my fellowship site under the Director of Community Wellbeing. My preceptor introduced me to their Community Health Improvement Strategy, or CHIS, work plan and learn about strategies and actions identified in their Caregiver Navigation Program. I encourage you, as you complete your fellowship, to reflect on the scope of work you completed with your preceptor and use them to leverage or enhance your skill as you begin your job search. During the fellowship, I learned about health initiatives that the other fellows developed throughout the school year and had a chance to know what others were implementing in their preceptor sites. Post-graduation, I started with a new job search application. I now work at the California Department of Public Health in the Chronic Disease Surveillance and Research Branch. I am a strategic alignment specialist leading project management processes for a comprehensive cancer control program and statewide cancer coalition. I implement strategic communication opportunities, collaborate cross-functionally with stakeholders and public agencies, to name a few, and consult and advise on 2 leadership committees to provide recommendations on our strategic plans in the state. I hope what you have learned at the Randall Lewis Health Policy Fellowship and Partners for Better Health contribute to your goals. I am proud to apply my experience from the fellowship to influence a positive change in public health systems and the built environment in my current role. Congratulations, everyone, on completing your fellowship. Best of luck.
Hi, everyone. My name is Stephanie Lau, and I am part of the 2020-2021 Randall Lewis Health Policy Fellowship cohort. I am also an alum of Loma Linda University School of Public Health, where I received my master's in healthcare administration in 2022, and I currently work in San Diego as the Data Integration and Interoperability Coordinator for the Community Information Exchange at 211 San Diego. I was part of a very special cohort, a cohort of public health graduate students that studied and served the community during one of the most difficult and important moments in global public health history, the COVID-19 pandemic. The pandemic caused everything to shift and accelerate in a virtual space. I started my master's degree in a physical classroom, working in person with my peers, to delivering my final practicum presentation via Zoom in my apartment. It was truly one of the most difficult times to adjust for not only myself, but for everyone, and especially for community health organizations and healthcare providers. But overcoming the challenges and difficulties presented by the pandemic has also opened up so many new and different opportunities into public health that I could not have imagined 5 years ago. It is because of this fellowship and the support of Partners for Better Health that I am currently working on designing a data infrastructure for providers like Kaiser and Blue Shield to work with community organizations like the YMCA and United Way to plan a continuum of care to work on the social determinants of health. It is because of the work I did for my fellowship, building a resident demographic dashboard for affordable housing nonprofit Hope Through Housing, that I became a community health data analyst and architect, working with hospital administrators, state legislators, and academic professors to uplift community health access on a national level. Everything I learned from my time as a fellow here, I have used in things such as creating community needs reports for San Bernardino and Riverside, and now San Diego County, and also how to leverage data community-based organizations had towards informative data visualizations like ArcGIS maps. And the social determinants of health, those are actually at the intersection of government, health provider, and community interests. So where you go from here can truly be anywhere you'd like. So I'll conclude by saying thank you once more to the folks at Partners for Better Health and for the generosity of Mr. Randall Lewis, and to express my congratulations to all of the cohorts for this year for completing your project. And I look forward to seeing you all soon in the public health space, making your own contribution to the work we do to make healthcare more accessible and achievable to the communities we hold dear. Congratulations and cheers.
Greetings, my name is Armando Hernandez, and I am a 2022 and 2023 Randall Lewis Health and Policy Fellow. This year my site was San Antonio Regional Hospital in Upland. I was assigned to the marketing department as a strategist to help different teams of the department plan projects and perform analysis to ensure the best decisions are made to reach or exceed their project goals. One project I was assigned involved social media strategy, whose main goal was to increase communication among all stakeholders of the hospital via using Instagram. This includes patients, employees, community members, and other outside organizations. The social media and public relations team would then use all communication as feedback to improve performance quality throughout all departments of the hospital. So we begin to track our current situation by doing a competitive analysis of the social media page. Our project was focused specifically on Instagram. The most important figures in our analysis involved the Instagram follower rate and the engagement rate. The follower rate is defined as the amount of new followers per month, and the engagement rate is defined as the percentage of individuals that engage with the content relative to the amount of followers the account possesses. After data mining, we found that our follower rate is 1.35%, or roughly 17 to 18 new followers a month. Our engagement rate is roughly 1.39%. As a reference, a healthy follower rate is anything above 1.69%, and a healthy engagement rate is anything above 3.38%. So we came up with strategies that aim to increase our engagement rate with our stakeholders. Two specific strategies we used were as follows. The first strategy was to make a consistent time schedule that will allow our posts to be more likely to be seen by a wider audience, which will lead to more shares, likes, comments, and followers. The second strategy was to engage the employees by giving recognition to their achievements. Doing so increases the likelihood of improved performance, as well as social media engagement from the employees' social group. Although the strategies of this project have only been carried out since the beginning of March 2023, There has been significant improvement in engagement since the campaign has launched. As a result, once more strategies are implemented in the future, we can predict an engagement rate of over 3% within 1 year, which will lead to an increase in patient feedback and improved quality care in all departments of the hospital. This project has provided benefits not only to the inside stakeholders of the hospital, but outside communities as well. I would like to thank La Sierra University, San Antonio Regional Hospital, Janie, and the Randall Lewis Fellowship Program for this experience. And I hope you all have a great day.
Hello everyone, my name is Aubrey Stark-Miller and I am a fellow with Randall Lewis for 2022-2023. I'm currently a grad student in the Master of Urban Planning program at the University of Southern California. My placement has been with the Step-by-Step program within Los Angeles County Department of Public Health, specifically the PLACE program, which stands for Policies for Livable, Active Communities and Environments. The Step-by-Step program works in unincorporated communities of Los Angeles County, specifically those that experience health inequities, have challenges to safe walking, and have experienced high rates of pedestrian accidents resulting in death or injury. Los Angeles County has one of the highest rates of pedestrian accidents in the United States. For this project, we work specifically in the 4 communities of East Los Angeles, East Rancho Dominguez, West Rancho Dominguez, and Florence Firestone. These communities have on average higher rates of obesity and diabetes and other measures of health as compared to LA County. The aim is to address safety while also encouraging healthy activity by changing the urban design of the built environment. PLACE collaborated with neighborhood organizations, mobility advocates, and residents to develop community pedestrian plans. The project is conducted over 3 years and is highly collaborative among community stakeholders, government agencies, and planning consultants. Several rounds of outreach, meetings, and workshops helped create maps outlining where in the communities there were problems and what urban design solutions would best address the issues. I helped with outreach by attending community meetings and facilitating workshops to get feedback from community members on specific incidences of dangerous places to walk. I presented information on health and urban planning, specifically how green space impacts mental and physical health, as well as the basics of city planning for Los Angeles County and how residents can get involved. Additionally, I created background and educational material for the website and in story maps to highlight the experiences of residences and community members. It was wonderful to work with these communities and learn outside of academia and professional spaces how environment design influences people's lives and see how residents adapt and work together to stay safe. It was insightful to learn how Los Angeles County is working to improve the urban design and address health, but these projects take a long time to implement and more efforts are needed to protect people who are struggling with these safety issues every day. Several issues would come up in meetings that were outside the scope of the project, speaking to how complex these problems can be and the bureaucratic roadblocks there are to getting these issues addressed. But work is being done, and I'm very grateful for the opportunity to learn from what the PLACE team is doing, as they wholeheartedly believe in the work to help make communities safer. After I graduate this spring with an urban planning degree, I look forward to building a career that addresses environmental health inequities, works closely with community members, and utilizes urban planning for improved health and well-being. Thank you.
Hi, my name is Crisela Lamas-Kralitz, and I'm a second-year MPH candidate with a focus in urban community health at California State University, Los Angeles.
Hello, my name is Dr. Bibharani, and I am pursuing my master's in public health at USC with concentration in health policy and community development. Crasera and we both are working together at Jamboree Housing for this fellowship.
The mission of Jamboree Housing is to provide affordable housing and services to strengthen communities. Affordable housing affects all 5 social determinants of health categories. Affordable housing can provide economic stability, proximity to quality schools and health providers, be in a safe neighborhood with access to transportation and green space, and create community unity. Jamboree has several initiatives to target social determinants of health. In this fellowship, we have held a resume workshop, career fair, and other services to target the economic stability social determinant of health.
With our various initiatives, we divided it into 2 goals. First goal was to, by the end of 2023, 10% of residents of Jamboree Housing will have increased their financial stability. The process was with the help of Kaiser Permanente Financial Health Initiative Grant, we arranged various resume building workshops, sessions, presentations related to credit, banking, and investments, and various job fairs. Our research has proved more than 85% of participants were actively looking for a job.
Our second goal was to create a health fair to address many of these social determinants of health. The goal of the wellness fair was to address mental health, nutrition, healthy lifestyles, and healthcare access specifically. Jamboree properties were first assessed to determine the most appropriate location for an educational health fair. Fullerton was chosen due to walking distance from the Jamboree property to the location, area size, and the presence of a park for our children to play in. Jamboree invited community organizations next to provide their services at the health fair. An English and Spanish flyer were created to advertise on Jamboree properties with community organizations and through social media. Third, entertainment was recruited, including a dance performance and a dance class to entertain families. Finally, a bingo game and anonymous post survey were created to assess the effectiveness of the health fair on educating the community with the raffle incentive to increase participation. A survey was also made for community partners.
We had various partners participating in our wellness fair, and they provided many benefits for Fullerton residents. America on Track has provided the benefit of learning leadership skill, fitness, nutrition, tobacco, and vape use prevention. Providence St. Jude Medical Center educated about Move More, Eat Healthy campaign. OC, Asian and Pacific Islander Community Alliance shared information about their mental health services provided in various languages. OC Healthcare Agency provided a helmet safety program. Every interested participant has received a one-on-one helmet fitting by a trained helmet fitter and received a complimentary helmet. OC PACE has provided seniors information about various programs for receiving the care and support they need to age independently. OC Buddhist Center shared information about meditation in Spanish. More than 25 participants have signed up for their complimentary sessions. WIC program has shared information about breastfeeding services, nutrition education, healthy foods, and how to connect low-income families with various resources such as CalPress, SNAP, etc. Partners for Wellness provided information about mental health condition, counseling, treatments, and various programs they offer.
In this fair, we found that 97% of participants learned about services they did not know about before, and 90% of participants plan to use information they learned at the health fair, share information with friends or family, see a healthcare provider, and or contact an organization for services.
In conclusion, this was a perfect match to work on as social determinants of health, health promotion, disease prevention, family development, and financial literacy. We brought many available resources together in Fullerton to bring financial independence to Jamboree residents and Fullerton residents. 9% of residents reported finding a new job before the end of 2022. Family Wellness Fair did a great job activating communities. It raised awareness about health issues and made various resources available for help and support. Most importantly, it showed residents that Jamboree Housing Corporation cares about the wellness and growth of communities.
These are our policy recommendations. We found that services provided by various nonprofit organizations are not advertised enough or done properly. This leads to residents either being uninformed or unwilling to participate, eventually missing an entire support system to improve the quality of their lives. Every grant approved to nonprofit organizations needs to have a budget for advertising their services, so communities will be engaged completely.
And last, we just want to thank everyone for giving us this opportunity. Jenny, thank you so much for matching us with Jamboree, and our preceptor, Benjamin Sanchez. He was always there guiding us and helping us. And definitely Femi, who was very helpful throughout the process. And last but not least, my partner, Crasera. We did it together and we did learn a lot. Thank you so much.
Thank you, Vipa.
Hello, everyone. My name is Kalisha Gilliam. I am a second-year MPH candidate at California State University, and I have the privilege of fellowshipping under Institute for People, Place, and Possibility, IP3. IP3 is a nonprofit focused on health communication to create sustainable communities. Products offered include Community Common, IP3 Assess, Fern, and the relaunch of CHNA.org. IP3 serve changemakers initiatives, health system, health department, professionals, and philanthropic collaborators. IP3 aim to use CHNA.org to catalyze the mindset shift needed in the field. Under the mentorship of the health communication teams at IP3, I am tasked with supporting the development and launch of CHNA.org. This is a new equity-focused CHNA guide and resource navigator to develop a roadmap for CHNA.org Community Commons Space, to lead content development for original content and resource curation. To do this, we work collaboratively to think through different processes and changes, to talk to professionals in the field, and to listen to stakeholder feedback used in implementation. Today, we are at the intermediate stage of the project and hope to reach completion by summer of 2023. Milestones: we develop questions to enhance platform development. We curate and review entities with leading practices. We meet with professionals in different healthcare settings nationwide to create equitable designs for CHNA content. We gather qualitative data to incorporate changes reflective of stakeholder interest, and we identify 8 steps which are guided practices recommended for that are instrumental in the CHNA process. Results show that stakeholders want us to focus on new and emerging content and implementing geographic features like ArcGSI, using ArcGSI, IP3 Assess for content users across the region. Stakeholders are excited about the Spanish version of the content. Partnerships, collaboration efforts are inclusive, and they recommend using CHNA.org as an experiment to implement changes we want to see in the field. In conclusion, we learned that CHNAs were diverse, with different practices for different jurisdictions and different healthcare settings. CHNA has more community benefits than most hospitals. No accurate description of community benefits is needed to engage all in the sector. CHNA.org require advocacy at the policy stream. Greater emphasis is needed in academia. Promoting community engagement in the CHNA process is a key feature.
Hello, I'm Cecilia Meza with the Master of Public Health program at Azusa Pacific University. For my project, I collaborated with Dr. Teresa Dodd-Butera at Azusa Pacific and carried out a health policy analysis of the One Health approach. My project explored the efficacy of the One Health approach in addressing public health concerns in special populations, while highlighting the importance of a multi-sectoral approach in tackling threats to public health and biosecurity. The One Health approach recognizes the relationship between environment, animals, and human health. Immunocompromised populations such as pregnant women and those with special healthcare needs are particularly vulnerable to zoonotic strains of infectious diseases, such as tuberculosis. The review concluded that infectious diseases disproportionately affect marginalized communities, and that the One Health approach has been effective in disease prevention, reduction, and surveillance. It also concluded zoonotic diseases can impose a significant financial burden on healthcare systems. It could cause harsh social and economic consequences for families involved and have severe health implications for individuals. To address these public health implications, policies and strategies should be developed to promote early detection, prevention, and treatment of zoonotic diseases. This includes increasing access to healthcare and diagnostic tools, promoting public education and awareness campaigns, providing financial support for affected individuals and families, and promoting interdisciplinary collaboration between healthcare providers, public health officials, and veterinary professionals. Overall, addressing the public health implications of zoonotic diseases requires a comprehensive and integrated approach that addresses the complex nature of these diseases and their impact on individuals, communities, and healthcare systems. These policy recommendations and supplementary handouts will be disseminated to the Carolyn E. Wiley Center for Children, Youth, and Families, Mother to Baby California, and the Center for Better Beginnings. I'd like to extend my most sincere gratitude to everyone at the Randall Lewis Health and Policy Fellowship and my preceptor, Dr. Teresa Dodd-Gutierrez. This fantastic opportunity has equipped me with the tools necessary to become a more well-rounded public health professional.
Hi, my name is Denise Trong. I'm in the 2022-23 Randall Lewis Health and Policy Fellowship cohort. I'm with the California Polytechnic University of Pomona, and my site is at the Upland Unified School District Nutrition Services, where I worked under my preceptor, Cassidy Boardman. The district is located in San Bernardino County and services approximately 10,000 students. This year, I worked on assisting the district with implementing Senate Bill 1383, which aims to reduce short-lived climate pollutants such as methane to meet climate reduction goals. This bill specifically targets food waste and requires that school districts recover the maximum amount of food possible. As a Randall Lewis Health and Policy Fellow, my project outcomes are to identify and analyze post-consumer plate waste during cafeteria mealtimes through waste audits, research best practices and other statewide approaches to SB 1383 implementation among school districts, create educational infographics, and conduct a spatial analysis of food insecurity and student poverty throughout the district. The project goal is to further establish a sustainable food recovery model. To create this model, I analyzed waste audit results among 4 schools and school enrollment data to understand the proportion of food waste per student. I also utilized food insecurity and student poverty data from multiple sources to analyze vulnerability on a census tract and census block level. The assumption is that these vulnerability variables are spatially relevant due to proximity, aka school by residence. My analysis shows that although Upland High and Pioneer Junior High generate significant amounts of food waste, Pioneer Junior High generates more food waste per student than Upland High. The elementary schools stay relatively proportionate. Census tracts and blocks with high vulnerability indexes, which are contributors to food insecurity, are in proximity to schools with higher rates of student poverty. Cluster and hotspot analyses confirms the concentration of vulnerable populations in southern Upland in proximity to schools with higher rates of student poverty. Therefore, my recommendation is that food recovery methods, such as share tables and food pantries, be prioritized in schools located in southern Upland to reduce food insecurity rates and alleviate student poverty. This includes collaborating with a local food pantry and teachers or faculty to set up consistent hours for school pantries. Additionally, food recovery education and outreach, such as engaging students in food waste curriculum, forming student-led green teams that sort waste, and collaborating with the city and/or county are best practices. All outreach and education methods should have Spanish translations, since more than half of the student body are Hispanic or Latinx. Nutrition services at Upland Unified is innovative when addressing food recovery and can be a model for other jurisdictions in the area. I thank Cassidy Boardman for her direction during my fellowship.
Hello, everyone. My name is Emily Giron Perdomo. I intern with the City of Montclair's Human Services Department with Dr. Alyssa Kalunga, and my project is the effects of the COVID-19 pandemic on human services programming. So the City of Montclair is part of San Bernardino County with about 38,000 residents. The Human Services Department oversees about 13 parks and recreational facilities, as well as different health programs. We know that the COVID-19 pandemic affected the way in which many people live. And this could also include perceived access to parks and recreational spaces, as well as health programs provided by cities. Because there is limited research on how the pandemic affected human services departments around the United States, we believe it's important to understand how it affected the city of Montclair. So we did this by completing a literature review and developing a study design. So as you can see in figure 1, our literature review showed 2 different conclusions. So a few studies found that there was an increase in park and program use during and after the pandemic, and this was likely due to physical health and social well-being. But interestingly, there was also an increase in park and program use as they also served for COVID-19 resources and vaccination sites. But a few other studies found that there was a decrease in park and program use, and this was due to built barriers in the built environment, difficulty accessing parks, economic distress, perceived risk to others. So based off of that, we created a quality approach. We're taking a quality approach in our study design, where we will collect data using focus groups or surveys that will, and we will be analyzing that data using software such as SPSS to find common themes of how the pandemic affected perceived access to parks and program use for residents of Montclair. And we will be sharing that information with stakeholders and community members. So because there was a mix in the literature review, we hope that the next steps will be implementing this study. And based off of the common themes we find, we hope to make recommendations that will lead to equitable access to all residents of Montclair, and access to program and park use. And that is all. Thank you.
Hi, I'm Emily Carrier, a Master's in Public Policy candidate at the University of California, Riverside. I did my Randall Lewis Health and Policy Fellowship project on community advisor conversations surrounding health in the Inland Empire. For this project, I was placed with the Inland Empire Community Foundation, which is a nonprofit public charity organization that works to identify community needs and create collaborative and sustainable solutions through resource development and allocation. In dedication towards these goals, IACF set out on a community listening project where primary data was collected via interviews with nonprofit leaders and community stakeholders. I was actually able to aid in drafting the interview guide, conversing with health experts, and coding common themes that came out of around 40 total conversations. To code for these themes, I analyzed all conversation notes and pieced together areas that seemed to be of importance to multiple parties, as well as potential areas where IACF could get involved going forward. It became clear that what the Inland Empire leaders care about will take a while to achieve, and thus IACF will have to commit to carrying this work forward over the next decade, for which they are definitely in the right space to do. For example, some of our resulting themes point to intersectional areas where health is both impacted by and impacts social conditions. So for this reason, it's important that these results be taken and addressed collectively with multi-solvers. In doing this, IACF is definitely on the right track to be able to direct funding towards areas of opportunity for the region going forward. I am so grateful for my time at IACF and the connections it afforded me. I'd especially like to thank Michelle Decker, Bree Grissett-Smith, Julian Cuevas, and Michael Wiafe for their support and trust during this project. I'd also like to thank Jolene Sedita and Laura Sosa for their encouragement and oversight during my time in the MPP program. And finally, I'd like to send a big thank you to Janie Boren and Randall Lewis for this amazing opportunity and training. Thank you so much.
Greetings, everyone. My name is Hina Thir, and I'm a Master of Healthcare Administration student from Loma Linda University. Under the Randall Lewis Health and Policy Fellowship, I have completed my practicum as a fellow with Shift Health Accelerator. Shift Health Accelerator is an entity founded on shared leadership model and convened by Culture of Health leaders at Robert Wood Johnson Foundation. The organization's core mission is to collaborate with community leaders, institutions, and organizations to dismantle structural racism, build community power, and also Shift envisions equitable access to resources by communities to achieve their full potential and transform the systems that affect their health. The most difficult challenge that is seen these days in terms of rural health equity is that critical resources are frequently out of reach for community leaders who are working to advance health equity at local levels. Typically, these resources are concentrated in urban and suburban areas, thus reinforcing and re-exacerbating the unique inequities that rural communities are facing. In order to address this challenge and increase investments in community-driven and owned health equity innovations, SHIFT convened a virtual rural equity roundtable in collaboration with Vertical Strategies, Interwoven, and financial support from Community Change Leadership Network, in which a network of Robert Wood Johnson Foundation community of health leaders were invited to discuss key issues. As a fellow, I was instrumental in planning, organizing, and analyzing the key takeaways from these discussions in order to propose viable solutions to the challenges at hand. The roundtable was structured around 3 questions: what community challenges rural leaders felt were not being heard, how they approached to health equity dollars in the rural spaces, and their thoughts on collaborative decision-making processes. The discussions revealed key parameters for advancing rural health equity, such as the need for funders to support capacity building, reframing social needs from a community perspective, the need for consistent operational funding, policy solutions for increased rural health investment, and the inclusion of rural champions to leverage intergenerational wisdom and bridge the gap between outcomes in urban and rural areas. This project specifically addressed SHIFT's core values of celebration of diversity, shared leadership, equitable allocation of resources, empathy, respect, and accountability to communities to promote well-being at regional levels. Via the analysis of the situation at hand, SHIFT proposes the establishment of a Rural Equity Roundtable Clinic in 2023, which will be structured as a combination of individual technical assistance, small group gatherings for shared learning and strategy, and the launch of Rural Health Participatory Grant-Making Fund and network approaches to healthcare accountability, focused on increasing investments in rural community-led changes. Via these efforts, SHIFT can advance field thought leadership opportunity to co-lead healthcare accountability efforts, leading to enhanced healthcare investments centered on community priorities and shared power dynamics through the establishment of a rural clinic, thus leveraging and working on the idea of advancing health equity in rural spaces. Thank you so much.
Hello, everyone. My name is Jennifer Cernas. I am a second-year Master of Public Health student at the University of Southern California. I've had the pleasure of working with Erica Phillips, the Community Health Investment Manager at Providence St. Mary Medical Center, to develop the upcoming Community Health Needs Assessment. This needs assessment is a collaborative effort between the hospital and the existing organization in the high desert region of California to better understand the populations they serve. The Community Health Assessment Toolkit by the American Hospital Association provides a framework for completing this needs assessment. The main components include a description of the community, social determinants of health, and outcomes. We define the community through the hospital service area as well as determining zip codes. Some of the social determinants of health include factors such as housing, food insecurity, income, and barriers to accessing healthcare. A few of the outcomes that will be listed include infant and maternal health, adult chronic conditions such as cancer, which involves reporting the stages of diagnosis and corresponding screenings. Hospital-based indicators such as readmission rates will be included as well. Throughout this internship, I was able to review CHNAs conducted by other organizations and those done in former years in order to make proper recommendations, identify gaps, and list new indicators. I also drafted survey questions that will be incorporated in the Community Health Survey and explored secondary data sources. Throughout the process of developing this needs assessment, there are a few implications that should be considered. In order to promote health equity, these indicators should include outcomes that have been historically faced by vulnerable populations. Given the limitations and availability of data, county-level statistics are used to report outcomes, but it's important to recognize that this could obscure findings. For example, reporting the CDC's age-adjusted incidence rate for breast cancer in San Bernardino does not account for the racial disparities in a specific zip code or neighborhood that is a part of our defined community. Additionally, many secondary data sources treat demographic variables such as race, gender, and age as mutually exclusive variables, when we should be looking at health through an intersectional lens and developing better stratification methods to properly display results. Health literacy is an essential part when creating material for community outreach, which should be a top priority. In conclusion, the thoroughness of a community health needs assessment is reflective of the strength of the existing network in the community. It takes a collaborative effort to create a comprehensive and timely needs assessment that will help guide future health improvement plans. I want to thank the Randall Lewis Health and Policy Fellowship for this wonderful opportunity. Thank you for listening.
Ketchamalea. My name is Jessica Mosier. I'm currently a guest on the traditional unceded lands of the Ohlone people, who have stewarded this land throughout the generations from the Pascua Yaqui tribe. Those lands are now called San Francisco, California, and I would like to just take a few minutes to go over my amazing fellowship experience with Build Healthy Places Network. They're currently located in Oakland, California. My preceptors are Ruth Thomas Squans and Ashley Hernandez. The focus of the projects revolves around place-based work and the unique needs of the BIPOC community, with the goal of advancing community-based solutions through cross-sector partnerships with community development corporations, otherwise known as the other CDC, health, local government, community development financial institutions, or CDFIs, and advocacy organizations to implement health and racial equity frameworks and catalyze neighborhood revitalization efforts. During the fellowship, I was able to provide my lived experience as a Native American and that of my Pascua Yaqui family members and elders. My conversations and research revolved around tribal sovereignty and indigenous social determinants of health, and other historical points in history that revolve around colonialism and how it redefined our journey here on Turtle Island. I was able to conduct interviews with stakeholders, Native-led CDFIs, Native community members, and elders. The resulting data was organized into questions for the BPHN Native Listening Circle, and then we summarized the results and generated content for distribution. Such content involved an expert insights blog post by myself, where I shared my reflections and insights about the meeting. I also created a media kit for their Crosswalk publication, which was to share with other FAME networks and websites and social media. And part of my conclusions that came from this fellowship was that it really helped me grow as a professional and leave behind the affliction of imposter syndrome, which makes me cringe today. Subsequent research alongside the interactions that I had with members of the Native American community reiterated the fact that we are so resilient. The aunties, uncles, elders, and cousins that I met along my journey shared their amazing work currently taking place in Indian Country and Capitol Hill. I was able to add to my skill set through training and utilization of Salesforce, Asana, and Slack. I learned leadership at a much higher level that you could not find in any textbook when I was witness to the change in organization where the executive director, Douglas Judy, left. He was the individual who started the organization, and he went to pursue other opportunities. As I witnessed as two humble, amazing, talented, strong women, Colleen Flynn and Ruth Thomas Squans, both step into the role of co-executive directors, and just nobody missed a step. Nobody really questioned what we were doing moving forward. Everyone's on the same page, it seemed like, from day one, based on the good relationship they already had with those leaders and the new team. Thank you so much for your time and for watching my video. Bye.
Hi, I am Karen Godina. I am an MPH student at Claremont Graduate University School of Community and Global Health. Through the Randall Lewis Health and Policy Fellowship, I was matched with Upland Unified School District to aid in the nutrition services and health education expansion to create connections between families and schools. Recently, Upland Unified School District has had the effectiveness of board policy on student wellness graded by using the WellSat 3.0 assessment tool. The importance of evaluating board policy 5030 on student wellness is to ensure that the district adheres to federal requirements and ensures student equity and student health in 5 domains: physical education and physical activity, nutrition, environment, and services, health education and nutrition education, integration, implementation, communication, and evaluation, and lastly, wellness promotion and marketing. After the WellSat assessment, the district began the School Health Index questionnaires. This questionnaire focused on each individual school as opposed to the district overall. Under the guidance of my preceptor, Cassidy Fernari, I completed a thorough analysis and comparison of both the WellSat 3.0 assessment tool and the School Health Index, which resulted in the completion of Upland Unified School District's very first triennial assessment. The triennial assessment is comprised of 4 components: comparison to a local school wellness policy, progress made in attaining the goals of the wellness policy, extent of compliance for all schools with the local school wellness policy, and lastly, the triennial assessment report to the public. With this, we found that Board Policy 5030 on student wellness has not been updated since 2014. Through the School Health Index, we realized that most schools, if not all, were adhering to federal requirements and more not mentioned within Board Policy 5030 on student wellness. Most importantly, there was a gap between families and schools, as the community involvement within schools was significantly low for most schools. To support the district's strategies for health education and promotion programs, I created a spring social media campaign and implementation methods, which will occur via Instagram and the district website, with the end goal of increasing followers by 20%. The goal is to keep the community updated with nutrition services updates, such as the completion of the triennial assessment. Throughout these projects and the assistance of my preceptor, Cassidy Fernari, I was successfully able to put theory into practice, and I have the confidence I need as I enter my career. I would also like to thank the Randall Lewis Health and Policy Fellowship for this amazing opportunity. Thank you for listening.
Hello, my name is Kira Terry, and I'm a Master of Public Health student at Claremont Graduate University with a concentration in health promotion, education, and evaluation. I was placed through the Randall Lewis Health and Policy Fellowship with Adventist Health Glendale to help out with their well-being programs, and they utilize the social care model for all of their programs to ensure they're creating awareness and enabling access to resources for their communities. Through their most recent community health needs assessment, 2 top priorities were established, including mental health and chronic conditions. They launched many programs as a result of this, and 2 of those in 2021 were Go Heart Wellness and Schools Mental Health. This past fall, I was able to step in to assist with both of these programs to gather insight and establish social care approach strategies through the vetting of resources from the spectrum of care in collaboration with community stakeholders to ensure we were meeting the needs of the community. With Go Heart Wellness, I was able to assist with multiple events where participants in the program were able to enjoy activities like sound meditation and yoga in the park. Go Heart Wellness has actually now grown to have around 1,000 members with 3 monthly events. Then moving on to the School Mental Health program. This program will actually be launching an engagement campaign that I assisted with in fall of 2023, and this will include a toolkit for school mental health across their different schools in Glendale Unified School District, particularly for high school students. That will include vetted resources, a website template, student outreach strategies, and feedback methods to really ensure that awareness of existing mental health resources is reaching their students. From the assessed needs, social care goals were reached in this area because of the collaboration we were able to have with the community. The continued expansion of these programs will greatly continue to improve mental health and chronic conditions. I learned so much in collaborating with the stakeholders in this area and how rewarding it can be to help through leadership skills, program management, and development that will really guide me into my career. I was also able to observe how connections between different levels of resources can greatly impact social care within this community. I would like to take this time to thank everyone at the Randall Lewis Health and Policy Fellowship, including all the fellows and Janie, and as well as my preceptor, Justin Henderson, for the wonderful mentorship I was able to have through this project. Thank you so much.
Hello, everyone. My name is Laura Sadi, and I'm a Master of Public Policy candidate at the University of California, Riverside, where I focus on health policy research, particularly that relational to marginalized populations. Through the Randall Lewis Health and Policy Fellowship, I was placed at Providence Health Site with my preceptor, Whitney Hagerson, the Vice President of Health Equity and Medicaid. The project I was part of focused on exploring current research and compiling best practices in the field in order to reduce health inequities in acute care settings. As a comprehensive healthcare organization, Providence is committed to serving the vulnerable and advancing best practices to reduce disparities and improve healthcare access for generations beyond. Health inequities are avoidable, and through the application of the social determinants of health framework, the population health team at Providence identified 5 core metrics in the acute care settings to improve healthcare equity. Therefore, for the project that I worked on, the Centers for Medicare and Medicaid Services Social Drivers of Health and the Joint Commission Health-Related Social Needs were set as standards to reduce in-hospital health inequities by focusing on 5 social determinants of health, which are economic stability, healthcare accessibility, educational accessibility, social community context, and neighborhood and built environments. For this project, I was tasked with creating a literature review on the best practices for sepsis mortality, anti-SV rates, goals of care, readmits for CMS conditions, and ED restraints. As part of the population health team and through the leadership of Whitney Hagerson, we strategized to develop tools that prioritize health inequities relational to race, ethnicity, socioeconomic status, and language. In regards to my tasks, I first compiled a literature review document highlighting current overall literature in the field relational to the above metrics. Second, I sorted the findings into 2 tables, one being for specific best practices and the other being general best practices, those in order to identify and avoid health disparities. Third, the review serves as a guide and resource for stakeholders during the implementation process of the project. For the second part of the project, I was tasked to create a health equity toolkit where I helped develop an internal site to support acute care units to meet the CMS and Joint Commission equity requirements. The health equity toolkit also focused on outlining action plans, performance improvement tools, aim or goal statements, and mitigation plans to eliminate inequities based on identified metrics. Overall, my placement with Providence allowed me to research in-hospital health inequities for acute care settings targeting vulnerable groups. Providence Health provided me with an opportunity to explore best practices to reduce healthcare access barriers. I would like to thank the Randall Lewis Health and Policy Fellowship, Partners for Better Health, Providence Health and Services, my preceptor, Whitney Hagerson, Marisola Cervantes, for this opportunity. Thank you.
Hello, my name is Lauren Macy, and I'm a second-year Master of Public Policy student at the University of California, Riverside. I was given the opportunity by the Randall Lewis Health and Policy Fellowship to work with the Rialto City Clerk's Office on their Healthy Rialto program, working alongside City Clerk Barbara McGee, former Senior Office Specialist Christian Gutierrez, and their team was an extremely valuable and rewarding experience. And I learned the processes behind a successful program designed to enrich and empower the lives of the community. Healthy Rialto offers programs and services designed to promote community well-being, supporting efforts to decrease food insecurity, increasing healthy food access to the community, assisting with community nutrition and education classes, and promoting CalFresh food, Market Match, and other programs through social media, events, and outreach. Community events are often promoted through the Healthy Rialto program, partnering with local nonprofit organizations. For the holiday season, we worked alongside Never Stop Grinding, a nonprofit organization, to provide the community with turkeys, food kits, holiday gifts for children up to age 12, and vouchers for the Rialto Certified Farmers Market. Both events were a success, along with larger events. Ms. McGee and her team host various groups like seniors, school districts, and others. This February, we hosted a group of students from the local school district and provided them with gift bags, including market vouchers, school supplies, and other items. Along with the larger events, this event was also a success as well. The market is a major player in the Healthy Rialto program and provides access to healthy foods from local farmers and vendors. We also accept SNAP and EBT benefits to offer access to nutritional fresh food and help increase food security in the region. The original Market Match program offers up to $10 match per week to shop for fruits and vegetables when using EBT benefits at the market. On April 5th, the city clerk initiated a pilot program through the Ecology Center that has transformed the way Market Match provides benefits and now offers up to $60 a month in CalFresh benefits for fruits and vegetables purchases, further incentivizing the purchase of fresh fruits and vegetables, as well as working to increase food security across the region. Another integral part of the Healthy Rialto program includes partnering with local farmers market vendors to host a monthly cooking and nutrition class. Our first class was a success, and participants were eager to learn how to make plant-based foods. When assessing the impacts of the program, I looked towards the numbers of CalFresh benefits redeemed and the number of community members served from July 2020 to the present, and I found it astounding. The Rialto Certified Farmers Market served hundreds of customers all throughout the COVID-19 pandemic and until present who use their CalFresh each month, and the benefits redeemed countywide showed that CalFresh Market Match is truly promoting the purchase of fresh fruits and vegetables in markets across the region. While we have so many ways to quantify health, nothing is more telling than the experiences of those in the communities that we serve. The outreach done through Healthy Rialto is essential to the community, and I learned through the members of the community how valuable the work done through Healthy Rialto truly is. Thank you to Randall Lewis and the Partners for Better Health for this opportunity, Janie Boren for guiding us fellows along the way, and my site preceptors, City Clerk Barbara McGee and Christian Gutierrez for the guidance, support, and invaluable experience.
Hello, my name is Lauren Sinks. I use she, her pronouns, and I'm a current Master of Public Health candidate at the Keck School of Medicine of USC in Los Angeles, concentrating in health services and policy. And I'm also a 2022-2023 Randall Lewis Health and Policy Fellow. Through the fellowship, I was privileged to be matched at the Community Health Improvement Program, or CHIP, department at San Antonio Regional Hospital in the Upland, Ontario area. While at CHIP, I wore a couple of different hats. For example, I would make post-discharge calls to patients with chronic conditions, and I would check in on them to make sure they understood their post-discharge instructions. For example, I would call patients with heart failure or pneumonia and make sure that they were able to fill their prescriptions, make follow-up appointments at their primary care, pulmonologist, or cardiologist, and ensure that they were able to understand those directions fully. I would also assess for social determinants of health, and for example, if they did not have adequate insurance or were underinsured, they may not be able to fill all of their prescriptions or any of their prescriptions, or if they had transportation issues and had a lack of adequate transportation, they may not be able to make those follow-up appointments. Additionally, one of the larger hats that I wore at CHIP was I created a report comparing the UCR health coaching program along with the CHIP health coaching program. And the reason for this is we wanted to use the UCR program as a model for integrating the CHIP health coaches into the new Care for You clinic. The Care for You clinic is a clinic associated with the hospital that is for these patients who may not have the opportunity to make an appointment with their primary care within a week of discharge, and so they're able to do that and get that care follow-up with the wonderful Dr. Wang who runs the clinic. And so what we found with this report is that it is a great model to use, and of course we'll have to tweak and make a few adjustments in order to integrate the structure into the culture of San Antonio Hospital, the Care for You Clinic, and of course the CHIP program. But currently we are working on a pilot rotation structure at the CHIP office to see what it would look like to have a few health coaches rotate in the Care for You clinic and get feedback from their lived experiences. So I'm really looking forward to those next steps within the CHIP office. I would like to thank Sandy Knox, my wonderful preceptor, and Janie, and of course everyone who was involved with this project. Thank you so much.
Hey there, everyone. My name is Lucy Briggs, and I'm a Master of Urban and Regional Planning candidate at UCLA under the leadership of Dora Beria and James A. Martinez, and in partnership with DB Legal Support. I have been studying the intersection of law and public health. In conducting research for environmental litigation, I engaged in 2 different case studies about the upstream determinants of health, and I learned about the power of law in regulating environmental hazards. So I focused on 2 different environmental health hazards, including oil wells and Superfund sites. For the sake of time, I will just focus on oil wells research here. I'll go into the spatial analysis that I conducted to pinpoint where these issues are concentrated. And finally, I'll outline an example of a past case where law was used to take action in support of public health. So in my analysis, I looked at the locations of oil wells across California. Oil and gas operations have been linked to multiple serious health consequences, including birth defects and cancer. And more than 2 million Californians live within 1 mile of an operating oil or gas well and may experience eye, nose, and throat irritation, as well as headaches and anemia. Oil production also represents a concern for drinking water. Some cities measured elevated levels of arsenic in their drinking water for years as a result of the groundwater contamination from oil drilling. So for a spatial analysis, as you will see in the top map in my poster, I examined where wells were concentrated within the city of Los Angeles. The highest concentration of wells lie in South LA and Long Beach, and all of the oil wells in this area overlap census tracts that are in the 75th percentile of populations of people of color compared to the rest of the country. So a few legal cases have been successful in regulating the oil industry in Southern California. A nonprofit group called Youth for Environmental Justice sued the city of LA for permitting oil drilling in violation of CEQA and other state anti-discrimination laws. The nonprofit accused the city of approving drilling operations without consideration of environment, human health, or safety. And they argued that the city had provided less protective conditions for majority Latino and African American communities than white communities. So the lawsuit was successful in creating new drilling requirements and raising some costs for drillers. And in addition to oil wells, I also examined Superfund sites, which will be detailed further in my handout materials. Overall, this analysis revealed some of these upstream environmental health hazards that maybe not all aspects of the public health system always consider. Spatial analysis found that both types of environmental health hazards particularly impact communities of color. Both have significant health impacts, such as respiratory issues, birth defects, and cancer. And overall, this work shows that law can be used as a powerful tool to mitigate some of these upstream public health issues and support movements for environmental justice. So thank you all so much for listening, and I look forward to seeing all of your presentations.
Hello everyone, my name is Master Dabo from the University of Southern California's Keck School of Medicine. With this fellowship, I have been paired with iDream for Racial Health Equity, a project of community partners, and my preceptor is Winona Valentine, who is also the Executive Director of iDream. iDream for Racial Health Equity is a Black-led community-based organization that focuses on leadership capacity and Black power building for advancing racial health equity and social justice in Black maternal and infant care in Los Angeles County and its neighboring areas. Before I go any further, did you know that nationally, Black mothers are nearly 3 times more likely to die in childbirth than non-Hispanic white mothers, and that Black women in LA County are 4 times more likely to die as a result of pregnancy complications? Research has shown that obstetric racism and not race is the root cause of inequalities in maternal health outcomes. For over 28 years, iDream for Racial Health Equity has strived to bridge the gap through community participatory research and utilizing the voices of Black people within the health system to change the narrative and improve birthing outcomes for Black families. By partnering with the Black community, allies, and the perinatal workforce, iDream is reframing this narrative from mortality and morbidity to hope and healing. In October of 2020, iDream launched the Black Mamas Glow initiative, which is a virtual pregnancy peer support group experience for birthing families in collaboration with Maternal Mental Health Now. Participants in the program receive mental and wellness support from Black perinatal professionals and from one another. Black Women's Glowing is reducing isolation and building community among Black women on their perinatal journey in an unapologetic space where they can discuss their struggles, successes, and aspirations with a shared understanding of the impacts of desiring a healthy, joyous, and sacred birth. My fellowship experience included attending interprofessional education meetings with the iDream Advisory Board members and weekly meetings with the Executive Director. I reviewed Black Mamas Glowing participant summaries and reports with the Home Lab Evaluator and the Black Mamas Glowing team. I developed written policies and practices to advance health justice that aligns with iDream's Justice, Equity, Diversity, and Inclusion Initiative. I attended external stakeholder meetings with the African American Infant and Maternal Mortality Committee and the Cherished Futures for Black Moms and Babies. I would like to acknowledge Janie and the Randall Lewis Health and Policy Fellowship organizers for this great opportunity. To Winona Valentine, thank you for your mentorship and guidance in every step of my fellowship experience. I appreciate the entire iDream and Black Mamas Glowing team for showing me the true meaning of working with a Black-led community-based organization. Thank you.
Hi everyone, my name is Matthew Fauché and I'm a current Claremont Graduate University MPH candidate. I was partnered with the City of Ontario, thanks to Partners for Better Health and the Randall Lewis Fellowship, and under the mentorship of Natalie Comero, the head of the Continuum of Care, I was able to study the effects of the opioid epidemic and potential abatement strategies in the City of Ontario. So currently, every day in Ontario, there's around one opioid overdose. And over time, year to year, the number of opioid overdoses are increasing steadily, as well as the number of overdose fatalities. Now, this warrants immediate action. So thankfully, the national opioid settlements have provided a significant amount of money, at least $100,000 per year for the next 18 years to Ontario, set to increase as more settlements are negotiated, to abate the opioid epidemic and the harm that it has wrought to the city. Now, my end of the project is to understand this opioid settlement, understand the data that fire department and emergency services have collected, and conducting stakeholder surveys to determine organizational impacts, and in conjunction with social impact artists, conducting focus groups with those who have opioid use disorder and those who are family and friends of people with opioid use disorder. So ultimately, my goal is a better understanding of the gaps and difficulties that come with dealing with the opioid epidemic in the City of Ontario. And one policy recommendation that is immediately supported by the data seen in the graph is the use of Narcan leave-behind kits, which the fire department is currently spearheading. We see that often, in most cases, Narcan does result in an opioid overdose reversal. However, there are gaps in that graph between the blue and red bars indicating that there are overdoses that could not be reversed because the fire department could not get there in time. These leave-behind kits will help shrink those gaps further and help prevent opioid overdose fatalities and scenarios where it takes the fire department longer to get to the overdose location. Additionally, support from the Continuum of Care, connecting people with opioid use disorder and addiction treatment centers, will be invaluable, as insurance coverage, cost, and lack of space at these centers is often a difficulty for getting people into treatment. Finally, initiation of youth prevention programs in high schools and community centers will allow for a decreased risk of future generations becoming dependent on opioids. And this project has been invaluable for me in both understanding the social determinants of health of opioid use disorder and in understanding the governmental and nonprofit structures in public health. And I'd like to thank again Natalie Comero, Partners for Better Health, as well as the Ontario Emergency Services and Fire Departments. Thank you.
Hello, my name is Morgan Turner, and I'm a Master of Public Health student at California State University, Los Angeles. And thanks to the Randall Lewis Health and Policy Fellowship, I have the opportunity to collaborate with AIM the African American Infant and Maternal Mortality Prevention Initiative. Specifically, I worked closely with the co-founder, my site supervisor, Adjoa Jones, as a part of the South LA Community Action Team. Altogether, that is the SLASB AIM CAT. Los Angeles County is divided into 8 service planning areas, or SPAs. The SLASB AIM CAT serves SPA 6, South Los Angeles, and SPA 8, South Bay. These 2 areas have been identified as high-risk areas due to the higher population of Black residents. Unfortunately, in Los Angeles County, Black infants are 2 to 5 times more likely to die before their first birthday when compared to other racial and ethnic groups. Research has shown the underlying cause of this health disparity is stress, caused by racism, discrimination, and system failures, such as lack of equitable, quality care. Infant mortality is a key indicator for population health. Higher infant mortality rates emphasize the lack of unmet health needs and lack of health education for Black women and Black birthing persons. This ultimately shows how racism is a public health issue that must be addressed to increase quality of life for Black people. As a part of the SLASB AIM CAT, one of my goals as a fellow was to identify gaps in services for Black families in SPA 6 and SPA 8. To obtain my goal, 3 objectives were completed. 1 was to conduct a needs assessment, 2 was to create recommendations on how to address the gaps, and 3 was to develop an online resource list based on objectives 1 and 2. As a result, in collaboration with Black Women for Wellness, a 30-page resource guide was produced that included emergency, housing, mental health, pregnancy, and LGBTQ+ resources and support groups. While the resource guide will play a vital part in providing resources for the South LA and South Bay residents and organizations, the recent passings of Mrs. April Valentine and Mrs. Bridget Cromer during childbirth further expose the importance of organizations like AIM. To decrease Black infant and maternal mortality rates, policy change such as the expansion of Medi-Cal, guaranteed income, and mandated continuous racism and implicit bias trainings for healthcare professionals can save infants and mothers' lives. AIM is dedicated to growing the village to achieve Black equity, and I'm glad to be a part of that village, and you can too. Thank you. Have a great day.
Greetings, everyone. My name is Natieli Diaz, and I am an MHA candidate at Loma Linda University School of Public Health. Thanks to the Randall Lewis Fellowship, as well as my site, the San Antonio Regional Hospital, Lewis San Antonio Healthy Communities Institute, I was able to focus my project on addressing the healthcare workforce shortage in the Inland Empire region. As we all know, the U.S. is currently experiencing a worker shortage within healthcare, and post-COVID burnout and resignation rates have exacerbated that shortage. California's current healthcare workforce is also not evenly distributed across the state. In our region, the IE, which includes Riverside and San Bernardino counties, and it's home to 4.6 million residents, we know and have estimated approximately 1,386,178 of those residents are currently living in areas that are experiencing a shortage of primary care providers. In San Bernardino County alone, we have 1 primary care provider per 1,700 patients. This worker shortage in our region has sparked a call to action from hospitals, healthcare institutions, community organizations, and academic institutions to address this worker shortage. My site, the Lewis San Antonio Healthy Communities Institute, has implemented programs such as The Wellness Starts With You, Young Healthcare Professionals, Positive Minds, Healthy Actions, and non-clinical internships in response to this shortage and to expose the next generation of healthcare professionals to the wide array of professions in healthcare. My objective and mission of this project was to examine the efforts of pipeline programs and academic institutions in guiding students or those individuals that are interested in careers in healthcare. My methods included an environmental scan, a SWOT analysis, and measuring the impact of programs through social drivers of health and civic muscle frameworks. One of the things that I want to highlight in my findings is that we in our region have an incredible network of high schools, community colleges, and four-year institutions that support individuals that want to indeed go into healthcare and pursue it as a profession. Some of the strengths that I also want to highlight of our programs is that it provides awareness of all the healthcare careers available. It also provides social and emotional training, such as our Wellness Starts With You and Young Healthcare Professionals programs. And we also, have the strength in health and wellness education, and financial literacy, and certifications of CPR, certifications of community health worker, and CNA. One of the things that I want to highlight is that investing in our future healthcare workforce, specifically here in the IE, by utilizing all of our partnerships, all of our academic institutions, and the current well-established pipeline programs, can only grow a thriving healthcare workforce in our region, can increase diversity, equity, and inclusion, and can advance the health of our entire community that we serve. Thank you so much for supporting our program.
Hi, my name is Priya Joshi, and I'm a Randall Lewis Health Policy Fellow and a Master of Public Health student at the University of Southern California, located right here in Los Angeles. As a fellow, I was placed at Adventist Health Glendale and HC2 Strategies, where I deeply examined the social care approach model as it pertains to mental health, substance abuse, and homelessness. Both the Substance Abuse Program and the Homelessness Projects are grant-funded teams to identify patients presenting with substance abuse disorders, as it focuses on providing dose stabilization in the emergency department and referring patients to critical outpatient care facilities and/or connecting patients facing homelessness to critical housing resources after discharge. This approach was inspired particularly from CalAIM's whole person care model. The program aims to move towards a value-based care model where providers are incentivized to offer comprehensive care that addresses all aspects of a patient's health. The social care approach is a key component to address upstream interventions, which seeks to address social determinants of health as a means to bolster overall community well-being and promote health equity. The social care approach involves a collaborative effort between health professionals, social workers, community health workers, and relies heavily on partner networks. Hence, as a fellow, I developed a toolbox for partner mapping and process mapping, both for the Substance Abuse Program and the Homelessness Projects, really in efforts to improve program efficiency, which is demonstrated in Figure 2 in the poster. I utilized the following framework: align, apply, and analyze, in which we aligned and bridged our patients to outpatient facilities via proactive support, applied the value-based care and social care approach to diminish stigma with patients facing substance abuse and patients facing homelessness, and 3, analyze, which evaluates the progress towards building an equitable community. Jumping midstream has enabled me to clearly define the workflows and process measures, and ultimately from the tasks at hand and the integration and application of the social care approach model, we can recognize that health is not only about the physical well-being, but also about the social and emotional well-being of the patient. Thank you for listening, and thank you Adventist and HC2 Strategies for providing me this wonderful opportunity.
Hello, my name is Rebecca Gutierrez. I am currently a Master of Urban and Regional Planning student at Cal Poly Pomona. Through the Randall Lewis Health and Policy Fellowship, I was paired with Gustavo Gonzalez, a city planner, and Jamie Cerda, a senior city planner for the city of Eastville, located in Riverside County. My project was focused on collecting literature review on the proposed 4-mile stretch neighborhood greenway that can possibly connect to their new site that will be used as a mixed-use retail, office, housing, and civic development. This literature review aims to identify the gaps in local planning and policy processes, which are essential for advancing community health through plans, projects, programs, and policies. Through this research, I found that the unification of green space and urban land use efficiency is the best solution to the challenges of land use. The World Health Organization recommends that every individual needs to live within at least 500 meters of green space, implying that green spaces need to be located within 5-minute walks from residential areas. Green spaces have a number of benefits, including mental health, physical, and social benefits. The proposed creation of the Neighborhood Greenway seeks to lean into this goal and contribute towards a growth of the city streets that support community health and the region's environmental perceptions. The proposed trail stretches from the city center to Chandler. There are 4 designated points of basin retrofit designed to connect the city's already existing and proposed new green spaces while improving the connectivity and accessibility of all the area neighborhoods. In addition, I found that Eastvale has a young demographic, which helped me create connections with Eleanor Roosevelt High School in Eastvale with the intention of bridging the gap between planning and youth. I have created a toolkit to create better engagement, relationship, and an understanding with the youth towards the community they live in. The goal of this toolkit is to teach students about the planning processes and what it takes to be a planner for their city, and in hopes of getting them involved in the process. This toolkit and the included activities can be used to give students the opportunity to imagine themselves as planners with ideas and thoughts that can make a difference in their community. The lesson plan is divided into 5-week course, with each week focusing on the following topics: general plan, zoning, land use, history, mobility, greenways, climate change, and sustainability. In children, green environments have been linked with better mental and physical health, including enhanced attentiveness, memory, learning ability, and significant decrease in stress. In conclusion, green spaces play a crucial role in environmental conservation by reducing urban heat, managing stormwater, and counterbalancing greenhouse gas emissions. They can also be used for social interactions, exercise, relaxation, and mental restoration. This project serves as a tool for creation of a greenway in Eastvale, its potential benefits, and youth engagement considerations for the future. Thank you all for your time and have a great day.
Hi, my name is Samuel Nikuze Furaha. I'm a fresh graduate from the Zapara School of Business. Through the fellowship, I was allocated in Kaiser Fontana, where, under the supervision of Ronald Kotecha, my role was to be able to help the Kaiser in the San Bernardino County to be able to decrease their conversion rate in video visits. Video visit is also known as telemedicine. It's a solution to the limited access of healthcare services. It allows patients to connect with healthcare providers remotely through video conferencing, enabling them to receive medical consultation and treatment without the need for physical travel to a healthcare facility. Kaiser Permanente in the San Bernardino County area saw an opportunity to enhance the quality of delivery of video visit. By delivering video visit, Kaiser Permanente can extend its reach to more patients and provide greater care access. With all that being said, there was a need one more time to enhance the experience of both providers and members as they engage with the platform. Let's say I decide or I book a consultation for a video visit, and the consultation starts. I jump on the phone with my provider, and for some reason that might be known or unknown, the provider or myself, we decide to switch from the video to a mobile phone, just probably because it's way easier. And so that act of switching from video visit to phone visit is what we call the conversion rate. So our work started off by identifying through the internal database all the MOB that had the highest conversion rate. The next step was to reach out to the different MOBs leaders in order to engage and show them the different statistics. Once we're done with the meeting with the different MOB leaders, the next step was to be able to engage with the providers, in which we again one more time show them the statistics, but we went one step deeper by giving the statistic per provider. And the last step was for us to provide a training to all the different providers and also staff, in which we show them how to use the platform so that they can be able to provide excellent services to the members during the video visits. I am happy to report that from the time we started the project until right now, we have seen a decrease in the conversion rate. By decreasing the conversion rate, the quality of healthcare access for the resident in San Bernardino County will be greatly improved.
Hello, everyone. My name is Shanice Hunt. I am currently a third-year PhD student at Loma Linda University, focusing on health policy and leadership. This year, I had the honor of working with DHJ Services, which is a health management and consulting firm with over 25 years of experience in public health, focusing on improving and sustaining outcomes of communities by shifting cultures, practices, and policy. This year, for my final project, I was allowed to assist on a community analysis of Connecticut. The goal was to utilize the community analysis to highlight the data on a web application that I was allowed to assist in building. In order to do that, we utilized a developmental process, which consisted of focusing on key stakeholders, aligning on key areas of focus, developing evidence-based research, and creating an accessible platform for community members. The key areas of focus were the workforce within Connecticut, access within Connecticut, innovation, and health equity. As you'll see on the webpage, we were able to provide a brief data snapshot for each of the subsections, as well as a brief synopsis. One of my favorite features is while everything is condensed onto the web application for easy reading and to make sure that we're capturing all of these key areas, there's also a learn more section on every subsection, which allows the reader to view more detailed data. Furthermore, the website also captures resources. While we're identifying gaps within Connecticut or help aids, we're also saying, here are the resources, this is what we're doing. We also highlight special events that are occurring, and we also provide an update on current public health matters and grants that were received by the Connecticut Department of Public Health, which is absolutely amazing to have a hub which is capturing the community analysis and also providing resources for the community. In conclusion, what I've learned from working on this project is how not only to utilize my data from a research standpoint, but how to ensure that the questions that we're asking are key for our communities that we are serving, that we're paying attention to the communities that we're serving, we're asking key questions, we're making sure that we're utilizing evidence-based research, and most importantly, the research isn't just sitting there. We're making sure the research is applicable, it is easy to read, it's easy to use, and is extremely accessible by our community and other stakeholders. So I wanted to say thank you for the opportunity to really help develop a project that has taught me how to think outside of the box. Oftentimes, we're only focused on creating positive data sets and not necessarily on making sure the data that we're creating is functional for our community members. Thank you.
Hi, my name is Sonia Mendoza, and I'm a Master of Public Health student at Cal State LA. For the Randall Lewis Fellowship, I was matched with Breastfeed LA, where I have learned about all of their efforts to achieve infant feeding equity. Infant feeding equity means that all families have the information, the tools, the support that they need to feed their families as they wish. This includes human breast milk. Breastfeed LA does this through education, outreach, and advocacy. My role focused on advocacy and really learning and supporting Breastfeed LA's efforts at a local, state, and national level. But why breastfeeding? Breastfeeding provides unmatched health benefits to both mothers and their babies. For example, babies are less likely to experience gastrointestinal issues, including constipation, diarrhea. They're less likely to experience asthma and diabetes in the future. Mothers are also less likely to develop ovarian and breast cancers. They also experience less heartache knowing that, or not having to take their babies to preventable doctor's visits. One of my primary responsibilities at Breastfeed LA was to coordinate and organize a statewide advocacy day where I was able to meet with lactation professionals, parents, advocates, and together we brainstormed how can we change or what can we do in 2023 to change the breastfeeding landscape. I got to listen to parents' stories of how their work or school or laws have failed to protect their right to breast or chest feed. I got to see the life of a bill from beginning to end to see how constituents can influence the legislative process. Everything from writing letters to being part of or sitting in on hearings and giving their testimony or simply meeting with their representatives. I also learned that advocacy informs advocacy. You learn who is willing to sponsor a bill, who's willing to champion a bill, or even who just cares enough to want to act on an issue. This is especially important to me as a first generation voter because I hope to move underrepresented communities to action. And in order to do that, I need to know all the possible steps that people can, actively engage in to make a difference. And Breastfeed LA has given me that opportunity to experience it firsthand and in the future be able to role model that for others. Thank you for listening.